we've got to get into this O shot. What exactly is it? And how on earth does it work?
The O shot was invented by Dr. Charles Reynolds in 2013. And it's started by him doing the vampire laser on Kim Kardashian. And he used the same concept of the PRP to inject from head to genitals. And he called it the Orgasm Shot or the O shot. And sometimes he called it in our seminars as the orchid shot, because the orchid resembles a lot of sensuality and femininity. And sometimes we call it the O shot because we activate the O spot, which is inside the vagina, and it's responsible for lubrication and squirting in certain women.
Welcome to Sex Intelligence, where we're going to dive deep into the science of sensuality, desire, and wellness. I'm Kim, today your host, and today we're unpacking something that truly doesn't get talked about enough: female intimate health. Joining me is someone who's been making waves in this space, Dr. Mike Shanuda, a physician, educator, and the founder of Genial Medical Centres in Sydney, Melbourne, Brisbane, and the Gold Coast. He specialises in sexual wellness, cosmetic medicine, and the revolutionary intersection between healing and pleasure. Dr. Mike, welcome to the show.
Thank you, Kim, again. And I'm so glad to be here and have this important conversation. Female intimate wellness is something we need to bring into the light, and with honesty, dignity, science, and medical.
So, great. I love this topic because it's not spoken about enough. So let's start with the big picture, okay? What inspired you to focus on this area, intimate wellness for women, and why is it still so much overlooked?
Great question. So many women come into my clinic with issues that they are suffering in silence for years.
Mm-hmm.
And pain during intercourse, vaginal dryness, incontinence, and difficulty achieving orgasms. So often they've been told it's just part of aging or part of being a woman. But it's not something we should just accept. These challenges affect confidence, relationships, and overall well-being. What inspired me was the opportunity to offer real evidence-based solutions like the O shot and laser gynecology, and restore not just function, but joy.
Oh, I think we've got to get into this O shot. What exactly is it? And how on earth does it work?
So the O shot was invented by Dr. Charles Reynolds in 2013. And it's started by him doing the vampire laser on Kim Kardashian. And he used the same concept of the PRP to inject from head to genitals and everywhere in between. So, and he called it the Orgasm Shot or the O shot. And sometimes he called it in our seminars as the orchid shot, because the orchid resembles a lot of sensuality and femininity. And sometimes we call it the O shot because we activate the O spot, which is inside the vagina, and it's responsible for lubrication and squirting in certain women. It's just your own blood, platelet-rich plasma, which we extract the blood normally as a sample of blood and centrifuge it and isolate the growth factor, which is rich plasma. They're gently injected back into the vaginal wall and the clitoris and all the erogenous zones internally, which are the O spot, the U spot, urethral sponge, G spot, back wall of the vagina, to stimulate and enhance the vaginal pacemaker, which we'll talk about in another session. So the idea of the platelet-rich plasma is to reactivate and regenerate nerve stimulation, vascular blood flow, and encourage tissue healing. So for many women, this leads to enhanced sensation, improved lubrication, stronger orgasms, and sometimes resolution of urinary incontinence and leakage. In fact, we know that only 20% of women can orgasm internally through intercourse, but we, as Dr. Shazano said, we activating the female orgasm system to achieve the best of the orgasms.
Wow, I like the idea of this. So it's actually using your own body's own biology to repair and enhance.
Look, exactly, it's natural. It's your own body healing itself. It's the power of youth in the growth factors. It's the power of achieving the best of activation and regeneration of your own cells that is needed for any region and any anatomy of your body. Hello and welcome. I am Dr. Mike Shinuda from Sydney, Australia, and I am thrilled to introduce you to my book, Unleash the Mysteries of Female Orgasms. This book is more than just a guide. It's a recipe for unlocking the profound depths of female pleasure and sexual wellness. I have dedicated my career to empowering individuals and couples to rediscover intimacy and confidence. So whether you're looking to enrich your relationship, overcome challenges, or simply understand yourself better, this book is your guide. So what are you waiting for? It's available on my website and major retailers. Let's transform the conversation around intimacy together.
Downtime. Any downtime?
So the downtime is minimal. It's even though it's an injection, but the numbing cream is very potent, and that will hardly any pain, but you will feel a bit bruised for a couple of days, like you've had a needle that should not have been there.
I understand. You also mentioned the laser therapy that can go in conjunction with this O-shot. How does that work alongside the O-shot?
Yeah, so little vaginal rejuvenation is uses very gentle thermal energy. It stimulates the collagen production, thicken the vaginal walls, and improve elasticity and hydration. So it's quite useful and helpful for women with atrophic vaginitis, vaginal dryness, prolapse, and when combined with the O-shot, the results can be even more powerful because we are addressing both surface tissues and deeper biological function as well.
Okay, so I think it's important that you can walk me through, or walk our audience through, all the areas around that, what this can help. What are the areas that can actually help? Of course.
So the main issue we are aimed at treating will be, number one, is difficulty achieving orgasms. So either the clitoral orgasm is lessened or internal orgasm is not achievable. And as I explained before, that 80% of women cannot orgasm internally by intercourse alone. Hence, Dr. Reynolds said activating the female orgasm system. In case of incontinence, urinary incontinence, both treatment can strengthen the pelvic support. In case of vaginal dryness and irritation, it improves hydration and tissue health. Then for intercourse, especially post-menopausal or postpartum, the vaginal laxity laser help restore the tone and tightness of the vaginal wall. So these are medical issues, but they are also deeply emotional ones. They impact how a woman sees herself, the confidence, the interaction with her partner, and the ability to feel the pleasure.
Yeah, that's something I really wanted to touch on because I think it's important. The emotional and the psychological shift that can happen by using these treatments. Do you see that change in your patients when you perform this?
And it's beautiful. It's my passion to see women coming back to tell me, you saved my marriage. To come back and tell me, now I see the world in totally different vision and creativity. And it's now uniting people, increasing their confidence and feeling from embarrassed and ashamed to walk out with confidence. And it's a whole sensual empowerment of a lifestyle that regain its strength and its power. So it's not about vanity at all. It's reclaiming identity, reclaiming pleasure and wellness.
So important for so many women today. I think it's fabulous that you can do these things. And for someone that's listening to this podcast, which I hope many people are, who is curious about this whole thing, but very nervous, because, unfortunately, we've never been encouraged to talk about this openly, which it should be done more often. So if they are feeling this way, how do you embrace this situation and make them feel more comfortable?
Look, start the conversation. Break the silence, break the taboo. Education is gold. Sex intelligence and knowledge is our responsibility to educate our patients, and women and men. But there's no pressure, and everything is about care, about consent, about education. And we tailor each treatment to the individual.
So, Dr. Mike, someone who's listening to this whole conversation, but they're curious, but they're very nervous, what would you say to them?
Look, I'd say start with a conversation. We need to break the silence, break the taboo, and it's such a sensitive issue to talk about, and it's important to have no pressure. It's all about care. It's about lifestyle medicine. It's about confidence. It's about the science and medical for women's health. So it's an issue to enhance intimacy, and it's absolutely worth discussing.
I think that's wonderful, and I can only but encourage our listeners who are out there, if they are feeling, they haven't experienced any of this and they want a little bit more of sex intelligence and knowledge about this, start that conversation. Feel happy to go and speak to your doctor, because I just can only say life is short. We need to make the most of our lives. So do what you can to improve your pleasure, your enjoyment, and your joy in life. So, Dr. Mike, you've also written a book about this topic. Is that correct?
Yes, correct. And it's called Unleash the Mysteries of Female Orgasms. It's a blend of science and explore the complexity of female pleasure, and also its simplicity and the art of knowledge and exploration. And it's available through my website on all major e-platforms and retailers. And it's my mission to help women understand their bodies, communicate their needs, and feel empowered and the confidence in their sensual lives.
Well, as far as I'm concerned, this is a must for my library, because I think it's very important to be able to enhance our situation, and sex intelligence and knowledge is powerful. Dr. Mike, thank you so much. I've really found this such a rich and very important conversation, and I hope it inspires more women to seek out the support, the knowledge, and the treatment that they deserve.
That's beautiful. Thank you, Kim. It has been an honor. Thank you.
Thank you.
Thank you.